morning again. I'm Martha Halko. I'm from the Cuyahoga County Board of Health, and I'm so pleased to have all of you here today. I'd like to spend just a couple minutes, not to take away from our wonderful keynote speaker, just laying some foundation and background and recognizing the others that really help us put this effort together. We have a wonderful planning committee, and we've actually been meeting since January to put this event together. And many of you have done events often find that, you know, it doesn't take that long. Why has it taken that long? I think it's taken that long because there was a lot of information to take in and to process and to look at how have we done our work in the past, how have we partnered in the past. And it really took us in some exciting new directions that I think hopefully carries on beyond this summit. But I'd like to recognize our planning committee. We had a wonderful group of folks, and we had representation from the Cleveland City Planning Commission, Cleveland Department of Public Health, the Center for Health Equity, Cleveland State University, the Cuyahoga County Office of Health and Human Services, the Cuyahoga County Department of Development, Cuyahoga County Planning Commission, Ohio State University, National Park Service, Rivers and Trails, the Center for Community Solutions, and RDK Active Health Solutions, our partner in crime, Bob Landon, who will be facilitating this afternoon. He's been very supportive. So I would like the planning committee to stand, please, and be recognized. This countywide effort actually, for us, stemmed from work in one of the communities in our own county, East Cleveland. And if any of you have gone through that community, you might see a lot of similarities to what you just saw in the Place Matters segment, Richmond, California. We've been in that community for almost 8 years under a cardiovascular health grant. And it's through the partnerships that we've established in that community, which were both grassroots, local, and countywide, that we began to see that this movement has to be bigger than just this one community. We continue to be committed to working in these communities. However, we need additional support, additional partnership to address the needs of our most needy communities. And we've also changed our program focus. Traditionally, we've been in these communities where we are working on behavior change. We're trying to figure out why we can't get folks to come out and exercise. Why can't we get them to eat healthier food? We've needed to relook at how we do our work in these communities, both collaboratively and based on the community's needs. So we've begun to address things differently in these communities. We've begun to look at the root causes of the health conditions that exist in these communities, because there's no question that the health outcomes are worse in these communities, and we haven't been effective in addressing those needs. So hence we've decided to take some different approaches and look at the social conditions and environmental conditions in these communities. Partnership has been critical in that process, hence the theme for this event today. We have had some wonderful partnerships. Specifically in East Cleveland, we've partnered with the Department of Development, looking at the assessment and revitalization of brownfields and incorporating health monitoring components into not just in East Cleveland, but countywide into their systems. And definitely with OSU Extension in the establishment of community gardens and green spaces. But our focus is to integrate health into the work that we do and bring health equity to the attention of all that are working in that community. We've established East Cleveland Health and Development Committee, which is a multi-sector committee. And I recognize that many of you folks are probably doing similar work in the communities that you work in. I think the time is right to begin to share these opportunities and discuss successes, best practices that others have had, and look more broadly to see how we can address these issues countywide. But we used the community engagement process. We wanted the community to drive the focus of the work and the accomplishments in that community. And although still limited somewhat by the funders in the communities that we work, so we are somewhat still funneled into particular programming, we have done our best up to date to engage the community in addressing their priorities. Their priorities have been nutrition and physical activity, land and environment, but the most critical priority has been safety. So that raises the challenges of how do we address that issue when we come in supporting nutrition and physical activity environments. So we have to get creative in how we begin to address the true needs of that community. This is a vacant property in East Cleveland across from the Coit Road Farmers Market. There are many vacant properties in East Cleveland. We're pleased to know that there's so much work being done in that community to revitalize the community neighborhood stabilization, community gardens, green spaces, and we have some representatives here from East Cleveland. Hi guys. We really enjoy working with them. And we've been able to work collaboratively to revitalize this property to a very successful community garden, one of several that we have in that community. And the community has really embraced that and taken leadership and engaged folks in that gardening activity as well as others. And we thank OSU's partnership for assisting with that.